Hello everyone, I am Dr. Elvis Joseph, surgical oncologist at Aster CMI Hospital, Bangalore. As we all know, October is the Breast Cancer Awareness Month. I am here to make you aware of the risks of breast cancer. As we know more and more through media, patients are coming to know about breast cancer. They also want to know how they can prevent breast cancer. For that, you need to know the risk factors associated with breast cancer. So we can broadly divide risk factors into modifiable and non-modifiable factors. So non-modifiable risk factors include age. As you get older, the risk of breast cancer increases. Most breast cancers are common in women in the age group of 50s or 60s. That is why we start screening for breast cancer at the age of 40. And sex, that is, women are more likely to get breast cancer compared to males. There is an increased risk of breast cancer in those women who have a family history, especially their first or second degree relatives. There are also certain syndromes associated with certain families. There is the BRCA syndrome, BRCA1, BRCA2, or the check mutations. These are genetic mutations which are inherited, and therefore there is an increased risk of breast cancer. Also, coming to reproductive history. The reproductive history can also contribute to a non-modifiable risk of breast cancer. That is early menarche, starting your menstruation before the age of 12 years, or having a late menopause, that is after the age of 55 years, or not having any children have an increased risk of breast cancer. Also, those who do not breastfeed their children for some reason will also have an increased risk of breast cancer. Coming to modifiable risk factors, we would talk about obesity, that is increased weight gain, which leads to increased production of estrogen in the body, and that leads to an increased risk of breast cancer. The other, poor lifestyle, like poor eating habits, having more processed food, processed meat, all these can contribute to increased risk of breast cancer. Also, alcohol intake, either in low moderation or in heavy quantities, can increase estrogen content in the body and therefore can lead to increased risk of breast cancer. Also, smoking, like all other cancers, can increase risk of breast cancer, both first and second hand smoking. So these are modifiable risk factors, and by doing some lifestyle changes, like by stopping smoking, by having good weight control, by doing proper exercise, at least 45 to 60 minutes of exercise every week, at least 2 to 3 days, and also controlling their weight, all this can reduce the risk of breast cancer.